Hi, I'm Mia Hébert, intern at the CBT clinic. This is a video about the treatment of panic as part of the lecture series. First, I will go through some definitions. So what is a panic attack? What is a panic disorder? And after, we'll see some statistics and also the causes of panic. I will also talk about the treatment, the different CBT techniques, and medication. And I will end this presentation by talking about tips. So first, let's talk about what is a panic attack. A panic attack is a sudden episode of intense fear that triggers severe physical reaction when there is no real danger or apparent causes. Panic attacks are felt in the body. The symptoms are heart palpitations, chest pain, shortness of breath, feeling of choking, nausea, sweating, chills or hot flushes, trembling or shaking, feeling dizzy, unsteady or faint, feeling of unreality or feeling detached, numbness or tingling. People must experience at least 4 of these 13 symptoms. Panic attacks can be very frightening. When they occur, people might think they are losing control, having a heart attack, or even dying. Panic attacks are a rush of fear, even if there no real or clear danger. People can experience sometimes even when they are asleep. It lasts for about 15 to 20 minutes with an intensity peak within 5 to 10 minutes, but it may vary. So it's really a rush of fear. People with panic disorder did experience panic attacks, and now they fear having a panic attack. So panic disorder is fear of fear. The person worries about the next panic attack. A lot of energy is expended to prevent it from happening. And the person may have safe objects, safe people, safe places. They may avoid activities or substances that can trigger symptoms, like coffee, for example. And they may check their bodily functions, for example, measuring their pulse. Panic disorder with agoraphobia. Half of individuals who suffer from panic disorder will develop agoraphobia. This is how panic becomes even more debilitating and may contribute to the development of depression because the person can feel limited in their functioning. So what is agoraphobia? It's fear of situation in which escape might be difficult or help may be not be easily available. So for example, in crowds, lineups, elevator, bridges, plane, buses, etc. Let's take a look at the statistics. So how common is panic disorder? 3.5% of people have panic disorder, and out of 3 are women. And most often it begins in early adulthood. And without proper treatment, panic disorder tends to be chronic. It often co-occurs with depression. So the cost of panic. People take twice as many sick days. They go 7 more times to their doctor. It can be debilitating, especially when associated with agoraphobia. It surely is exhausting. It is associated with alcohol use, social withdrawal, and high level of comorbidity with depression. So let's take a look at the causes of panic. Panic disorder can be seen as a blend of biological and psychological factors. For the biological factors, norepinephrine and serotonin are chemicals that act as neurotransmitter or messenger in the brain, and they send messages between different areas of the brain, and they are thought to influence one's mood and anxiety level. One theory of panic disorder is that symptoms are caused by an imbalance of one or more of these chemicals. Although it's believed that some genes might be at play, there's still no scientific evidence that point to a specific one or certain genetical function. But we know that those with relatives who have a panic disorder are 3 times more likely to also suffer from panic. About the psychological factors, I said earlier, panic disorder is the fear of fear. So one of the psychological factor is that there is a catastrophic interpretation of the physical sensation of the panic attack. So this is really an important point. So about the treatment, there is 4 dimensions I will talk about. The first one is relaxation. Second one is cognitive restructuring. After I will talk about exposure and then medication. Oh, relaxation, there are many ways to relax. I will talk more about diaphragmatic breathing, paced breathing, passive and active relaxation. So the first one, diaphragmatic breathing, is a technique also called deep breathing or belly breathing. It's really simple. It's focusing on the breath as an effective way to encourage your body to relax. To practice this technique, you can place one hand on your upper chest and the other one just below your rib cage. This will allow you to feel your diaphragm move as you breathe. And the technique is to breathe slow through your nose so that your stomach moves out against your hand and the hand on your chest would remain as still as possible. So only your belly is moving. So the paced breathing is slowing your breath down purposefully to focus on the lane of your breath and calm your mind and body. While sitting, you can breathe through your nose for count 4, for example, and then you hold your breath for another count of 4, and you release your breath through your mouth with a whooshing sound for a count of 8, and you repeat 3 to 4 times. Passive relaxation is about allowing yourself to deeply rest and let go. So it can be as simple as watching a movie or taking a bath. Active relaxation, in a sense, is active, so it's any activity that relaxes your mind and body while still engaging with them. So it can be meditation, yoga, sports, for example. There is also mindfulness. Mindfulness means maintaining a moment-by-moment awareness of your thoughts, feelings, bodily sensation, and surrounding environment. Research has shown that mindfulness is an effective way to reduce anxiety. So through mindfulness training, we acknowledge our thoughts and feelings, that our thoughts and feelings are always changing, and we learn to accommodate them with a sense of gentleness and acceptance. So So the second part of the treatment is cognitive restructuring. So first, there is a psychoeducational component of the treatment. For example, we inform the person that panic attacks are not dangerous. They will learn about the symptoms and also how the nervous system works. Then the therapist may suggest a thought record, for example, to do some cognitive restructuring. The goal is to change the thought that lead to panic. So by changing the thoughts paired with the psychoeducational component, the person will interpret the physiological arousal in a correct way. So a way that does not generate more anxiety. So about the nervous system, there is two branches. So the sympathetic that is responsible for the fight or flight response, and also the parasympathetic branch that is responsible for returning to homeostasis, the baseline. So these two branches are adaptive and essential for emergency response. So in an emergency, the sympathetic branch become activated, the adrenaline is released, so the heart rate increases, the breathing rate increases too, the blood goes to the muscle and is drained from the digestive system and from the brain, and you feel like running a sprint. The parasympathetic branch become activated and induces a return to normal. The emergency response from our nervous system is not dangerous, it is not harmful, it is a normal and adaptive response to danger. The difference is that in panic, this response from the nervous system is a false alarm. So there's no real danger. There is common faulty thoughts that may come to one's mind when they are experiencing a panic attack. People may think, I will go crazy, I will faint, I will have an heart attack, this will never stop. Everyone will see that I'm anxious, for example. And these thoughts maintain the symptoms of panic and panic disorder. So how panic develops and is maintained. When someone has healthy thought, they may think this is simply anxiety and it will pass. So as they thought this, the anxiety decreases and so do the sensations. But if the person has an unhelpful thought process, they may think, oh, I should not be having these sensations. What is wrong with me? And then this leads to more anxiety and the intensity of the sensation increases. So it creates like a cycle. People may be hypervigilant to their sensations and they may scan their body for the sensations they fear, and sometimes they detect changes and they interpret those changes in a catastrophic way. This leads to the cycle and may trigger even panic attacks. So they tend to overestimate also the probability of dying or going crazy. For example, they may read the news or hear stories about people who were supposedly healthy and died of an heart attack. And this kind of behavior and thoughts will reinforce the thought that this is dangerous, and also the hypervigilance. So, The person, with the help of his or her therapist, will replace unhelpful thought with more helpful one. For example, this is anxiety, this is not dangerous, it will pass. At most, it is unpleasant. This is okay, I have dealt with it before, etc. It is also important to know that it is not because they happen without warning, the panic attacks, that the sensations of panic needs any catastrophic medical explanation. So the heart rate increases, but it's anxiety. It's not a heart attack. The breathing rate increases too, but it's anxiety. You're not gonna collapse. So this is important to know. Oh, we do not go with the emotion of fear, but instead we trust the logic. So, if the person feel that they are not getting enough air, they are most likely hyperventilating, so they have too much air, so they should slow down their breathing. So for agoraphobia, symptoms of panics are not dangerous. Thus, panicking in any situation, lineup, crowds, elevator, bridge, etc., is okay. The real cause of the symptoms is adrenaline. So the feared element and triggers is anxiety itself. The situation or setting is irrelevant. Um, as therapists, we also propose a technique called interoceptive exposure. With this technique, the person will expose herself to internal sensations, the internal sensations that they fear. The goal is to break the association between physical sensation and the catastrophic interpretation of those sensations. So we replace it with physical sensation linked to more neutral thoughts. So, example of interoceptive exposure techniques. We encourage people to hyperventilate, to breathe through a straw, to spin, to swallow very fast, to squeeze their arm. The goal is to replicate the same sensation they fear. So we do a lot of repetition daily, and usually the therapists demonstrate how to do it. And there must be no distraction for the technique to work. So let's see, how does it work? So the anxiety follows a curve. At first, it will increase and then have a plateau, and finally it will decrease. The more we do it, the more we practice hyperventilating, repeating those bodily sensations, the less intense the anxiety will be, and it will decrease faster. If it's not prolonged, it will confirm the idea that the anxiety does not diminish, and it will also reinforce the fear and the avoidance behavior. So it's really important to stay with the anxiety. Sometimes it takes 45 minutes to really do all the cycle, all the curve, and to see that the anxiety will decrease. There is also another form of exposure. We call it systematic desensitization. It's for people that have panic disorder with agoraphobia. We suggest to create a list of agoraphobic situation from least phobic to most, like a hierarchy. And then we start to do exposure with the least agoraphobic situation. The person exposes herself till she is comfortable with the situation or in the situation. So the person should do it within sessions and also between sessions. So the person has to give up safety cues, safe item, distraction, any kind of reassurance, because it won't be as effective. So we need to avoid avoidance and to face the fear directly. So there is also medication. So let's talk briefly about medication. There is two main classes of medication, benzodiazepine and SSRIs. For benzo, they are fast acting, but they can become addictive if they are not taken as prescribed. So this is important to discuss with your doctor. For the SSRIs, Celexa, Paxil, Prozac, and Zoloft, you have to take them daily and they reach their full effects in weeks. So if you want to know more about medication, I suggest you can talk to a doctor. CBT and medication are equally effective treatment, but CBT is associated with a lower rate of relapse than medication. Also, it might be helpful to do some CBT and to take medication. Also, because it can help people to do some exposure. Let's talk about some tips. So the first one is practice relaxation daily, whether it is through deep breathing, progressive muscle relaxation, meditation, visualization, yoga, exercise. Um, it is important to practice it because the more you do it, the easier it will be. So you can also familiarize yourself with the practice of mindfulness. There is some app you can download. There is a lot of Google video, YouTube video that can help you help people learn those techniques. So another tips is remember that anxiety can cause an array of physical sensations. So increased heart rate, chest pain, rapid breathing, dizziness, nausea, numbness, even blurred vision. And so this is the anxiety, and this is not a medical condition. So tips 3, regardless of their intensity and of whether or not they occur out of the blue, these symptoms of panic are not dangerous. So the person will not faint, die, or go crazy. Number 4, if you feel like you are not getting enough air, you may be getting too much. So if it happens, you have to to slow down your breathing instead of trying to get more air. Tips 5. The phrase, if you're not willing to have it, you will, does apply to symptoms of panic. So it's important to practice acceptance of the physical sensation, not try to control them. It won't be helpful. So mindfulness techniques may be helpful in some ways to practice acceptance. 6, know that the physical symptoms of anxiety which are due to autonomic nervous system activation, are brief. You don't feed them with catastrophic thoughts. So the real issue is the physical experience, psychological experience of fear, not the physical sensation per se. So remember, it lasts for about 15 to 20 minutes at most, and it's not dangerous. So it's really the thought, the catastrophic thoughts that may create a cycle and increases the anxiety. So avoidance is what maintains fear. So expose yourself to physical sensation. If you fear your heart being fast and or not breathing well, go for a run up, go down the stairs. If you feel dizzy, spin in a chair. So you can replicate the sensation you fear, expose to it, and then see that it's not dangerous. To work, exposure has to be plunged, and you stop when you are not more fearful, and you must repeat it daily. So it's with repetition that it will help decrease the anxiety. Tips 9. Use fear of animals as an analogy. If you are afraid of dogs, treatment will involve exposing you gradually to dog. With panic, you are afraid of bodily sensations, so it's the same. Treatment involves exposing you gradually to, in a controlled manner, to physical sensations. And the bottom line is that to panic, you need two things: physical sensations and a catastrophic interpretation for them. Learn to accept the physical sensation, but challenge the catastrophic interpretation. As we saw, it's possible to work on unhelpful thoughts. So, summary. Panic is fear of fear. The fear is an adrenaline response, as meaning there is an emergency. So what you can do, you can relax, but not just during the panic attack. Before, after, it can be really a practice in your life. Prepare a cue card with a realistic alternative to your catastrophic thoughts so you can work on those thoughts. You can also seek exposure to physical sensations and situations associated with these. There is some books that can be helpful. 10 Simple Solutions to Panic, and also the Anxiety and Phobia workbook 3rd edition. So thank you very much for listening to this presentation about panic and panic disorder. If you have any question, I will be there to answer those. Thank you.